Hello, good morning. This is Chris. Today we're going to talk about pediatric disorders in kids. The first one we're going to talk about is the cerebral palsy. Cerebral palsy is a non-progressive injury to the motor center of the brain, causing a neuromuscular problem of spasticity or dynechesia. Dynechesia is involuntary movement. So this brain part that is called the basal ganglia, that is responsible for the communication between the brain and the muscles. This is where the defects usually occurs, and so is a defect that usually about the motor movement in kids. So it usually manifests itself through the cognitive impairments, seizure, failure to thrive, voluntary movements, a delayed developmental milestone in kids, and poor suck and tongue thrust. When we treat, we usually target maximum comfort for the child. So we usually do an anticonvulsant, that is phenytonin. Of course, we know that phenytonin therapeutic level is 10 to 20 mcg, and also it has this side effects of drowsiness and ataxia. So ataxia is a loose muscle control of the arm and leg. We can also do a diazepam that we use to manage the muscle spasm. So we usually also manage this. We can do a physical, occupational, speech therapist to find a way to manage it. And sometimes the nutritionist and the surgeon can come in, work together, and see how we can give the baby a comfort. Also, the second one we're talking about is the spinal bifida. The spinal bifida, also known as the neutral lobe defect, is when the neuron loop doesn't close well at the back. The loop that covers the backbone central nervous system and the spinal cord. When it didn't close well, the loop doesn't close well and is exposed. So it usually causes a physical and intellectual disabilities ranging from mild seizure to a severe seizure, depending on the level of the opening. So it's usually caused by a lack of folic acid by the mom. If the mom didn't take enough folic acid during the pregnancy, that's usually the cause. This defect can usually at worst lead to death or paralysis, paracentesis, hydrocephalus, and we can manage this through surgery, fluid, fiber intake can be managed. So the third one we're going to talk is the bacterial meningitis. This is a serious one because this one, if not managed well, can lead to death or a permanent disability. It usually affects the brain, the learning disability, and this particular one is about the inflammation of the meninges. The meninges is responsible it covers the brain and the spinal cord. So this is a very vital area in human body. So it usually caused by streptococcus, and sepsis. This can really lead to organ failure or death. So it manifests itself through the increased white blood cell, decreased glucose, increased protein, increased ICP, intracranial pressure, and the Keggington sign and Bruxelles sign are usually there, and the stiffness that comes with it. We'll do and usually manage this by doing an antibiotic therapy, antipyretic as prescribed, and when doing this we monitor the vital signs, the neurologic sign, and there's always a seizure precaution. Of course, that this has to do with the brain, and the spinal cord. So we'll look out for, because of the ICP, make sure that the patient doesn't go into shock, and if he does, we'll be prepared and make sure the environment is free so that it doesn't sustain more injuries. Now we'll move to talk about the cleft lip or platelets. This is the manufacturing of the face oral cavity that seems to be multifactorial in hereditary origin. So it's manifest through the failure of the fusion of the hip, a difficulty sucking or swallowing. So for treatment, we do surgery. The initial surgery closure of the cleft is performed when the baby is about around 3 months of age. And between the 10 and 12 months, we also do a surgical closure of the plate defects. So usually we promote family bonding through this proper patient airways, making sure the patient has a patent airways, is breathing very well, and we feed slowly, and we remove oral secretions carefully from the baby. So the last one we're going to talk today is the Down syndrome. The Down syndrome is the one of the most common chromosomal abnormality in kids today. So it usually causes a physical and cognitive disability. This occurs when the cell, the cell division is abnormal. As a result, there's an extra genetic materials from chromosome 21. And it can range, it can cause a lot of things, ranging from the cardiac, respiratory, the feeding difficulty, delayed development, low IQ, and even hypothyroidism can be present. So usually what we do is just to give the child and the parents support. We have to support them and make sure they get the maximum comfort. We monitor the growth and development. We do the usual therapy, occupation, speech, physical therapy can be involved, and this usually affect the cardiac and the respiratory. So we have to watch out for it, make sure that every point in time there's a patent airway for the child. So this is where we're going to stop today. Thank you for listening. Have a wonderful day.